Hello, happy Friday, Junior. So I said last week that I was going to start doing some videos on some common diagnoses that I see. This is the first one. I want to talk about bladder pain because I feel like it's very common and we don't talk about it. And when we go to the doctor, a lot of times we're just kind of given a medication, or they might say, oh, you have IC, or they might do a cystoscopy, but it's negative. So then it's like, now what do we do? And here is the spark notes on bladder pain. Super common in men and women. It's probably more common than we realize. A lot of people don't get diagnosed with interstitial cystitis until like their 30s or 40s, but your symptoms are happening earlier. Like maybe people in their 20s are getting these symptoms, and they're spending years like searching for a diagnosis. And we need to work on that. So I have people all the time that are like, oh, I also have bladder pain, or I also have urgency, even if that's not why they're coming. And we need to address these things earlier, I think. So bladder pain can be from a lot of reasons, but the one thing I definitely know is that there's oftentimes some kind of muscle dysfunction. It could be hip, pelvic floor, abdominal, low back, something in there. Could be multiple. But addressing that dysfunction can actually help with the bladder pain because of the proximity of the bladder to the pelvic floor muscles and how the pelvic floor muscles support your organs in your spine. And they have to allow for urination and bowel movements, and that's part of their job. So that's why pelvic PTs are here. That's just one example. But if you have bladder pain, reach out to me or another pelvic therapist. But I really love treating. Well, I love treating it all, but I really do feel passionate about the bladder pain, whether or not it's considered interstitial cystitis or not. I think there's so much we can do and so much education out there that physical therapists are really great at getting to their patients. So that's it for bladder pain, and let me know if you have any questions. Bye.